Well, high school is full of memories for teenagers. There's the football games, the proms, SATs, and getting your wisdom teeth out.
That is the truth. It's sort of a rite of passage, right? Here to tell us more about this rite of passage for most young adults is Dr. Danielle Cook and Dr. John Wessel with Carolina Center for Oral and Facial Surgery. Good morning to both of you. Thank you so much for being here today.
Thank you for having us.
Okay, first off, what exactly are wisdom teeth?
So wisdom teeth are actually the last teeth to develop in the most posterior aspect of the mouth. We also know them as third molars. They are the last to develop. They are the last to erupt into the oral cavity. And unfortunately, nowadays, we don't have enough space in our oral cavity for them to erupt fully. So if they do come in, they only partly come in, and that will lead to problems in the future.
Well, Dr. Wessel, what can happen if you don't do anything about these teeth erupting in your mouth?
Yeah, the problem with the wisdom tooth, when they come in an abnormal position, they're going to predispose the other teeth to cavities and bone loss known as periodontal disease. And to be clear, it's not just the wisdom tooth that's affected, but the adjacent teeth as well. So in this example, you can see the wisdom tooth is laying sideways. It has a large cavity on it, and the cavity has basically spread to the adjacent tooth. And now both of these teeth need to be removed. In the next example, we talk about the other major concern with wisdom teeth, and that it has certain cells on it which may degenerate over time into cysts and tumors. So if you look at this x-ray on both sides, the lower wisdom teeth have these large lesions around them that have eaten away most of the jawbone. And now this patient is at risk for jaw fracture. And these problems can be prevented with removal of the wisdom teeth at an earlier age before they become symptomatic.
I had no idea. I thought it was just because there wasn't enough space in our mouths for all those teeth and that our teeth would just go crooked. I didn't know all that could happen too.
Yeah.
There's a lot of reasons to get your wisdom teeth out. Dr. Cook, what exactly is involved in the removal of wisdom teeth?
So typically when we are removing wisdom teeth, we will do this under IV sedation. That is the most comfortable means of doing this procedure. So our patients will come in, we evaluate them prior, make sure everything is safe at the time of surgery. They'll come in, we hook them to monitors and start them on oxygen, get an IV in. We're able to push the medications slowly and safely, and once they're asleep, we go to work. And guess what? When they wake up, we're finished.
It's all over. They don't remember a thing. They don't feel a thing. You don't remember a thing.
Not a thing. Yeah.
What ages should we talk about getting your wisdom teeth taken out?
Yeah, you guys kind of mentioned the high school rite of passage.
Yes.
And, ages 15 to really 22 is really the age range we're kind of looking for. And it's more favorable for the patient because the roots of the wisdom teeth aren't fully formed yet. The bone tends to be a little bit softer, so the recovery is a little bit faster for our patients at that younger age, and there's less risk of complications. The other notable factor is once your braces come off, many times the orthodontist will send you over to us to take the wisdom teeth out to prevent shifting of the bite.
Talk more about the recovery after the surgery. What is that process like?
So the recovery is typically a 2 to 3 day process. Our busiest days, obviously, then are Thursday and Friday, where these young kids don't miss very much school. A lot of other times are breaks, school breaks, summer breaks, Christmas breaks, so they're not missing school at all. But typically 2 to 3 days, we're all feeling a little bit better. By 5 days, we're getting back to normal, and you can get back to school about the 3rd day for sure.
Well, quickly, what is this awful dry socket I hear about? What is that?
Sure. So dry socket happens a couple of days after the procedure, and the initial blood clot that forms, it becomes dislodged. What happens is you have this underlying exposed bone, which can be very uncomfortable. The good news is, if it happens to one of our patients, we want to hear about it right away. We're going to get you into the office. We'll put a dressing right inside the socket, and you really feel better within minutes.
See, it's not a big deal. We've all had this done, right? Carolina Center for Oral and Facial Surgery is offering a complimentary consultation now through the end of May. Just mention Charlotte today for the special offer. The number to call, it's on your screen, 704-716-9840. Again, 704-716-9840. Or visit their website. It's mycenters.com, mycenters.com. Thank you so much for being here today.
Thank you again for having us.
Great to see you.
No doubt. All right, well, coming up.